the hospital is in such a financial state that it cannot afford basic supplies to take care of our patients, including toilet paper, pulse oxes.
Chantel Venter was the interim chief financial officer for RMCHCS for 4 months, until Tuesday when she says she was suddenly fired.
What is ending the day early?
No, I've been terminated.
Security escorted Venter out of the facility the morning after a community meeting where she presented her plan to turn the hospital's financial situation around.
Speaking on behalf of the hospital, I can confirm that the situation is dire. I'm not going to sugarcoat it. In fact, I am a turnaround CFO, and I've often called into situations where hospitals usually the bankruptcy situation. My email is full of local businessmen, local businesswomen, some of whom are here tonight, that have been asked me to pay their outstanding invoices, and I just don't have the money.
Venter says the hospital is down to 3 days of cash on hand. County commissioners claim there's enough money for 10 to 15 days. Either way, it's not looking good. We asked how the county is working with RMCHCS to keep the doors open.
Right now, we're heading in the right direction with the county currently being able to control the board or appoint the board members.
While commissioners plan to appoint a new hospital board within the next 10 days, appointments don't equal more cash flow. A new board will inherit the same lack of funding. If the hospital closes, the closest option for patients in the area is an hour away. Venter says the devastation would also carry over to Gallup's economy.
When you're looking to bring in new businesses or building schools or adding infrastructure, it's the hospital staffs and their spouses that work in the area. They're the ones that take those additional jobs. It's outside businesses thinking about moving in, want to make sure that their staff can have a place where they can have sustainable health care.
An RMCHCS rep sent us this statement, but it only addresses medical and office supply shortages, nothing about a potential closure. It says in part the hospital has enough of both, and while it values the community's concern and involvement, donations are not needed. Brianna Wilson, KOB4. People at the Rehoboth McKinley Christian Hospital in Gallup are claiming that the hospital's heating and cooling system is broken. Now, apparently this has been an issue for several months. That summer heat wave reportedly making conditions inside the hospital almost unbearable for those working and receiving treatment. Now, we asked McKinley County officials and hospital leaders what they're doing to address these claims and concerns.
The lobby thermostat was clocking at 93 degrees.
Jalen Hinckley says she went to the hospital earlier this month after coming down with symptoms of COVID.
I was sitting in there with a fever with other people that were experiencing illness, and we were sitting in a room that has no ventilation, that has no open windows.
When she got to her room, she said it wasn't any better.
Even with the fans on and the bay door open, which is the only door to the outside from the ER, my room that they put me in was 87 degrees.
Another patient said he had a similar experience this month.
One of the more clever nurses I overheard, because my door was partially open, was that she was equating her experience there in the ICU with hot yoga.
Hospital officials tell us this has only been an issue since yesterday, and they've already fixed the problem. An RMCH rep sent us this statement today saying the chiller went down early Wednesday morning. Technicians made repairs, and it was back online around 11 a.m. Our plant operations department is working through a phased plan to make improvements to the HVAC system. From time to time, we do experience warmer than normal temperatures, but continue to provide safe health care to our patients. But during the most recent McKinley County Commission meeting, worried community members said these problems go back to the beginning of the year.
Back in February at the public portion of the board meeting, it was stated that there was a solution and a quote for the fixing the HVAC system, and the intention was for it to be fixed before the hot summer months. The staff that we have spoken to have been told that, quote, the issue has been fixed, or that that's just the way it is, and it doesn't seem that they have any real understanding of what the problem actually is, or of any timeline for its remedy.
Board Chairman Billy Moore argued that the pandemic has made it hard to order a new system, or any supplies for that matter.
Most supplies are anywhere from 30 days to a year and a half. I recently ordered a new truck, and they told me it'd be 2023 before I could get it.
Now, Commissioner Moore also told me $850,000 have been approved for a whole new HVAC system, which is supposed to be installed right away.
Brianna, just 2 months ago, that same commissioner told you the hospital was down to its final 2 weeks of cash on hand. What happened there?
Well, today, Commissioner Moore told me that the hospital's financial situation is much better than it was back in April. He said the hospital had been waiting on some reimbursements from the federal government, and the county ended up setting up a loan agreement with a local bank. Now, he added that the issues with this hospital are not going away overnight, but between hospital leadership in McKinley County, things are moving forward. Of course, we will watch closely to see if real progress is being made.
A laundry list of problems continues for a troubled hospital that a lot of people rely on. Last week, we told you how some patients were sounding the alarm about sweltering hot hospital rooms at Rehoboth McKinley Christian.
Even with the fans on and the bay door open, which is the only door to the outside from the ER, my room that they put me in was 87 degrees.
Hospital officials tell us they've fixed that problem, but the allegations over the AC were only the latest in a long list of things going wrong, including concerns over the hospital's finances. A couple of months ago, a whistleblower said the hospital only had a few days of cash on hand. Well, the hospital managed to come up with a short-term solution, but now it's in financial trouble again. Today, the McKinley County Hospital Board gathered for an update. Brianna Wilson has been on this story since the beginning. Brianna, today you tried to take the people's concerns to the top. Did the top brass answer questions about their current financial situation?
Well, Ryan, the short answer is yes and no. And really, that financial situation isn't looking good. The RMCH board did admit that they're down to less than 2 weeks of cash on hand. That comes out to about $6 million. And a fraction of that amount comes from a line of credit that they pulled from a local bank that they say the county helped them get a hold of. Today, the hospital board at RMCHCS took questions and comments from the public.
First issue that was concerned is that we understand that there is a $25 million deficit that we are facing for the year 2022.
I experienced the lack of air conditioning while spending 4 days in the ICU.
We asked a few questions too.
Some recent patients that I've spoken with indicated that they received care here earlier this month during the first week of June. The response I received from the hospital last week indicated the issues with the chiller began on June 22nd and were resolved almost immediately. So has this been an issue prior to June 22nd? How long has the hospital been working to address this issue? And I've also noticed fans running around the facility today, so I'm wondering if the air conditioning is currently working in all areas of this facility.
Board members said they would post their response to these questions at a later time, but did briefly touch on the hospital's HVAC system. They say that supply chain issues are slowing progress on installing one that works.
Now, where do we stand in terms of supply chain issues? Because I know all of these pieces of big equipment, things like electrical panels, three-phase panels, those kinds of things are in high demand and in short supply.
They also laid out a stark financial situation.
The outpatient revenue is down $13.6 million from budget.
Also saying the hospital has 11 days of cash left on hand.
So total cash of about $6 million right now.
Hospital leaders say so far it has withdrawn $1 million from a line of credit that the county helped them set up with Pinnacle Bank. They are using the remaining $5 million in that line of credit as a safety net. Now, hospital leaders acknowledge that the situation is not a good one. They also said that the hospital won't be able to bounce back from all of these issues overnight. Coming up at 6:30, we're hearing from community members who say they're more than a little worried about their hospital. Well, just like you said, Ryan, they're feeling frustrated, upset, and really unsure of where to place their trust right now. Their biggest concern is with CHC. That's the outside organization that's overseeing hospital operations at RMCH. They say that the hospital doesn't have the public's best interest in mind, and also says that things have gotten worse since CHC has taken over. Now, demonstrators, they stood on the corner of Boardman and College Drive just down the street from RMCH, holding signs that said things like CHC deceives and the heat is rising in the ER, but not the elevators. Now, many were members of the Community Health Action Group, also known as CHAG. They say they formed the organization out of necessity to create a platform for RMCH patients, current and former employees.
We realized several months ago that many of the staff were feeling unheard and feeling like they were experiencing a lot of retaliation at work, and we noticed too that a lot of them were starting to leave. What we realized very quickly is that the reason why many of these staff were leaving was because of hostile management and because they felt like they weren't being heard on safety issues.
For example, some of those issues with the heating and cooling system at the hospital that apparently have been going on for months, reportedly causing unsafe conditions for patients and for employees. Some areas of the hospital even reaching up to 93 degrees. CHAG says that they're frustrated that the hospital is only announcing a plan of action to repair that HVAC system now. Ryan?
Brianna, earlier you said hospitaliers admitted they only had days of cash left on hand, just $6 million, and $1 million of that comes from a line of credit with a local bank that hospitals claim to be using as a safety net. So is the money situation even worse than it might sound?
Really nobody knows, and that's why people like CHAG are confused and they're hopeful and they don't know where to turn for answers and correct information. And that information at the board meeting was only brought up after somebody pointed that out. That was when the board meeting or the board actually admitted that they don't have $6 million of cash on hand. They really only have $5 million because they pulled that $1 million from the line of credit with Pinnacle Bank. Now, demonstrators we spoke with say there are so many other questions that are going unanswered here, and even though the hospital board laid out current finances, they did not lay out a clear plan to get RMCH back into a safe zone.
What I wanted to hear from the hospital and what we've been wanting to hear from the hospital is an acknowledgement of how bad that is. And we really want details of a specific plan about how we can get out of that. Honestly, in order to save a hospital that's this distressed, we need everybody to pull together. We need the community to be on board. We need staff to be able to speak up freely about the issues that they see. And it's very clear that that's not happening.
Now, Ryan, in the past, the hospital has said organizations like CHAG, who are speaking out against management, are trying to divide the community. But today we've heard a lot from both sides, everyone saying that they want this hospital to survive, and the only way to do that is to pull together. Now, we're still waiting for a response from RMCH on all of the questions that were asked during the public portion of today's committee meeting, and a rep tells me that it could take days to hear back. That's right. So this goes into effect August 3rd. That's next Wednesday. RMCH will be taking its last labor and delivery patients on July 31st, so they can be delivered and recover before that nursing coverage goes away. Now, after August 3rd, patients who are having medical emergencies will be able to go to the Gallup Indian Medical Center across the street, regardless of their beneficiary status. That includes labor. But for expectant mothers who are able to plan ahead, the closest place to receive care is Grants, an hour away. So a family medicine physician currently doing obstetrics at RMCH told me that the hospital is helping its current patients set up care in other places where they can deliver. The hospital CEO, Robert Whitaker, says there is no timeline for when the labor and delivery unit at RMCH will reopen. He also explains why this is happening now.
And just a lack of people, of both nurses and physician coverage. We understand how important this service is to our community, and are working to ensure that when we do have the pieces in place to have the program back up and running, that it's set up for the long term, and we have a good program for families.
Now, Whitaker says the nurses who work in labor and delivery now will be reassigned to other departments in the hospital next week. And this is the second time that the labor and delivery unit at RMCH has closed in the past year. We're going to hear the concerns from community members coming up tomorrow evening right here on KOB 4.
Exactly a week from tomorrow, a troubled New Mexico hospital is closing its labor and delivery unit for the second time in less than a year.
One Gallup man shared his family's experience at Rehoboth Christian McKinley Hospital last fall. That was the first time the department was shut down. He said his wife was 35 weeks pregnant, and she started having painful contractions, and they were worried their baby was coming early. So he took her to the emergency room at RMCH.
They didn't have like a normal labor and delivery room set up. They put us in like a storage closet that they had modified to be a hospital, they put a bed in there for patients, but it looked to be like the cleaning and maintenance closet. There's like mop buckets and just other random things. It did not seem like a hospital room at all.
Yeah, so they said they ended up going home that night and eventually delivered their baby in Farmington, almost 2 hours away.
And this is just one example of the uncertainty so many expectant mothers in Gallup are facing in just more than a week's time. Brianna Wilson has been keeping a pulse on this struggling hospital for months now. So, Brianna, do we know what the available care options are going to be for folks in that area who would need it, after next week?
Well, Tessa, Ryan, there is another hospital across the street from RMCH, the Gallup Indian Medical Center, and officials with the Indian Health Service tell us they are prepared to take on more patients, but only in emergency cases.
Gallup Indian Medical Center, PHS, as we locally call it, is the closest, is the other hospital in Gallup.
GIMC is an option for all expectant mothers who need emergency care.
It is primarily for PHS beneficiaries, but patients who are having medical emergencies can present there and still receive care regardless of their beneficiary status.
That includes labor and delivery. The Indian Health Service sent KOB4 the following statement, saying in part, they will continue to provide emergency care to everyone and non-emergency care to all IHS beneficiaries. They also said GIMC is prepared and is making the additional staff adjustments necessary to handle the increased patient volume. GIMC strives to provide quality care to all patients treated at the facility.
The closest hospital for non-beneficiaries is Grant, the Cibola General Hospital.
But that's almost an hour away. RMCH says it will take its last labor and delivery patients this Sunday, July 31st, so they have time to deliver and recover before the unit closes. Right now, the focus for staff is making sure those who will need care following the closure have somewhere else to go.
We're working with our patients to establish care with other local places where they can deliver. So when I see my patients in clinic, or if I haven't seen them, I can give them a call. I've been giving them a list of other local hospitals that have active labor and delivery units.
The hospital is also prepping its emergency room staff just in case.
The emergency room providers are getting some extra training right now to make sure that they're up to date on stabilizing these patients. If I'm available or Dr. Jackson's available, we'll try to assist with that process as much as possible.
Now, the hospital CEO says there is no timeline for when the labor and delivery unit at RMCH will reopen.
Brianna, what role does the state play in all this?
That's a good question, because at some point you would think the health department could step in here.
Well, we actually checked in with them, and MDOH says they can step in if the hospital as a whole is shutting down. Now, we're not talking about a single unit here. Even then, they would need a court order to intervene. Now, state officials sent us this brief statement saying that they're aware of the labor and delivery unit closure and continue to be in routine contact with RMCH leadership and their plans for maintaining continuity of services. Now, of course, we will continue to closely follow this story and the impact that this will have on the Gallup community. Robert Whitaker, the CEO of Rehoboth McKinley Christian Hospital, or RMCH, addressed the Gallup Hospital's dire situation during a recent meeting with the Legislative Health and Human Services Committee.
So there are some services that we just can't provide in the community, and so people need to travel to Albuquerque for higher acuity, kind of a higher tertiary care.
Whitaker further explained the hospital's decision to temporarily close the labor and delivery unit this summer, citing a financial analysis of the first 7 months of this year.
We experienced a loss of about $10,000 per birth.
He says these hard decisions are part of the overarching goal to make sure Rehoboth McKinley Christian Hospital doesn't shut down completely. Meanwhile, concerned community members are calling for the state to step in.
We really think that the state may be our best hope for turning the situation around.
Community Health Action Group organizer Dr. Connie Liu believes the hospital meets the requirements for NMDOH to legally take the reins.
The hospital is losing $800,000 to $1 million a month with a projected loss of $24 million for this year alone. We are concerned that quality and safety are dangerously weak. The Department of Health is authorized to seek receivership if a facility presents a situation, physical condition, practice, or method of operation that the Secretary finds presents an imminent danger or of death or significant mental or physical harm to its residents or other persons.
The New Mexico Department of Health sent us a statement saying it continues to monitor Rehoboth McKinley's ongoing challenges and evaluate any possible next steps. As they have stated before, receivership is not a normal procedure, and they would need to seek a court order to take any action. Brianna Wilson, KOB4. A near $1 million lawsuit filed by 3 New Jersey companies accuses Rehoboth McKinley Christian Healthcare Services of fraud and misrepresentation, conversion, unjust enrichment, and breach of contract, among other things. Here's some background. RMCHCS works as a continuing medical education provider, so it receives grant funding that it's supposed to pass on to event organizers like these 3 businesses out of state. But this claim, filed in New Jersey Civil Court on November 16th, alleges the hospital has been holding on to that money. This lawsuit lays out multiple accounts of RMCHCS failing and refusing to pay invoices despite repeated demands from companies. We see it right here. Despite repeated demands, RMCHCS has failed and refused to pay. Again, despite repeated demands, failure and refusal to pay. We see it here again, and again, and again, and again. And then right here, the lawsuit alleges that RMCHCS unlawfully retained or misappropriated more than $162,000 in educational grant money. According to the suit, Rehoboth owed more than $1.4 million at one point, but has since paid that down to $973,000. The lawsuit does not speculate on what RMCHCS has done with the money it has not paid back. We called a hospital representative.
Hello, Dr. K. This is Dr. Ray.
And the office of the attorney who filed the suit.
Thank you for calling the law office of Alec, Petriello, Gooden, Plaza, and Reed.
Both calls went to voicemail, so we followed up with emails. As of this afternoon, we have not heard back. It's possible RMCHCS has not even seen this lawsuit yet. If we receive a response, we'll let you know. Brianna Wilson, KOB4.
Nearly 2 weeks after a near $1 million lawsuit was filed against a troubled New Mexico hospital, those who rely on it for care are calling on our state to step in and help. Brianna Wilson has been following the saga with the embattled hospital for months now. And Brianna, today you heard back from our New Mexico Department of Health and Attorney General's office.
That's right, Tessa. So they didn't say much about the situation with Rehoboth McKinley Christian Healthcare Services in Gallup. The Attorney General's office sent us this statement saying we are aware of the concerns surrounding the management of the medical center and will step in to protect the most vulnerable if the concerns are substantiated. The Department of Health told us it has no comment on this pending litigation. Now, concerned community members say without support from the state, they don't know where else to turn, and they worry RMCHCS won't survive much longer without help.
We have spent a lot of time bringing to light issues related to dire staffing issues at our hospital, non-payment of various vendors, the dearth of supplies, and most importantly, issues of patient safety that will result in patient harm, imminent harm, and have resulted in harm.
The Community Health Action Group, led by concerned Gallup community members, says it's not surprised a $973,000 lawsuit was filed against Rehoboth McKinley Christian Healthcare Services earlier this month. 3 New Jersey businesses are accusing them of holding on to grant funding that they're supposed to pass on. An email we obtained from the hospital's own education coordinator sent 16 days before the claim was filed in New Jersey Civil Court indicated the hospital used more than $1.7 million to pay for non-educational expenses.
We've tried to bring attention to these various issues to anybody who might be able to investigate them and to provide the kind of oversight that we are thus far missing.
The Community Health Action Group says it's asked our Department of Health to step in multiple times. When the hospital's labor and delivery unit closed in July, DOH sent us this statement saying they were aware of the unit closure and continued to be in routine contact with hospital leadership, but no action was taken.
Unfortunately, it also seems that we have a state who seems incomprehensibly unwilling to do any actual investigation of the patterns of fraud, waste, and abuse that we have been continually pointing out and have only been confirmed by this current lawsuit.
The group says it also sent a letter to the Attorney General's office in June and never received a response. Now, RMCHCS did not respond to our request for comment today, but did send us a statement last week. It reads in part, "We have been in regular communication with our educational partners, including several that are party to this lawsuit, about those funds that are in question and are ensuring that repayments are made. To be clear, we have and will continue to reimburse our CME partners to pay for educational activities, and we are confident that this will be resolved in a timely manner." Now, we have a copy of the lawsuit and the full statement from RMCHCS at KOB.com, and we will continue to track any developments in the situation. So from the labor and delivery unit closing to heating and cooling issues, accusations of mishandling hundreds of thousands of dollars, now we have this investigation. Now, I did speak with a representative from the NMAG's office. I also got a response from the hospital CEO and the Community Health Action Group in Gallup. The New Mexico Attorney General's office is investigating Rehoboth McKinley Christian Healthcare Services. A rep says the AG's investigations can be triggered by any number of factors, including failure to comply with registration requirements. RMCH was recently fined $100 because of its failure to register as a charitable organization during the 2021 tax year. For more than 5 months, the hospital's status was listed as delinquent, and not for the first time. According to state records, RMCH has failed to register as a charitable organization 7 times since 2009. The Community Health Action Group in Gallup says it's been asking the state to step in and address hospital concerns for a while.
I'm cautiously optimistic that this is the first step towards understanding the fundamental issues that are plaguing our hospital at the moment, and so I'm glad that they're taking this step to investigate.
Robert Whitaker, the CEO of RMCHCS, sent us a statement attributing the hospital's failure to file to some turnover in its finance department. He said as soon as they became aware an extension had not been requested, they called the state. The hospital's status as a charitable organization was reinstated in December, and its deadline to file registration documents pushed out to March 30th. The CEO went on to say this in no way impacts or affects the care RMCH provides its patients.
What I'm most concerned about is that we've seen repeated instances that the hospital doesn't have the basic capacity at the moment to perform basic functions.
Now, the Attorney General's office also tells us it's important for organizations to complete registrations on time because it provides transparency for donors. And there are consequences for being considered delinquent, including fines and the fact that donors will know they are not compliant. Now, on top of this investigation, RMCHCS was also recently placed on a 1-year probation by the New Mexico Medical Society, following the hospital's failure to pass on nearly $1 million in grant funding to continuing medical education programs. Now, the probation limits the type of funding the hospital can use to support the CME accredited activities that they offer, and requires them to send in monthly financial statements to make sure they're paying back everything they owe. Now, in a statement, the CEO of RMCHCS confirmed the probation, saying they've worked closely with NMMS and they have been very helpful through this process. And we'll continue to follow both of these situations as they develop.